Hi viewers, I am Dr. Adithya Somayaji. I am a consultant orthopedic foot and ankle joint replacement and sports surgeon at Yashoda Hospitals, High Tech City. So today we are going to discuss about sports injuries, the active people's injuries around foot and ankle. So the common sports injuries around foot and ankle are ligament injuries, and also sometimes you get stress injuries, stress fractures, and sometimes you get pure fracture, full fractures. So ligaments are bands-like structures which connect between the two bones. There are a lot of ligaments around the foot and ankle that can be injured, especially while playing. So the common ligament injury that we see is ankle sprain. There is a lot of common wording called ankle sprain. So the ankle sprain is when moment your foot goes this way, this part of the ligaments get damaged. So whenever these parts of the ligament get damaged, that is called ankle sprain. And there is some other terminology called as high ankle sprain. So when you fall from height, when you get a very big impact, you will get something called as high ankle sprain. So the injury can include this part. So both are can be dangerous, can be debilitating if not treated properly, primarily or later. So the primary treatment is very important, and it's important to meet the doctor and not neglect it and playing on it. The other injuries that can happen in the foot and ankle are foot injuries. So whenever the sports people land on feet, there are a lot of ligaments around the feet, even the connections around the feet. So these can also be damaged. So sometimes the toes get hyper mobile, and toes get movement like this, toes get moved like this, and they can be injured. So the other injuries are there. So moment you see the doctor, usually the common problem is there will be a lot of swelling and pain around the ankle. You will not be able to put weight sometimes. So the moment you have this injury, there is no way you should continue the sport. First thing is you need to take immediate rest. The first aid treatment should be given, like rest and ice pack, and give few painkillers, and before you go to a doctor. So, and it's also important to immobilize it by putting some wrap or some crepe bandage, something like that, and to prevent weight bearing. So rest is very important. The initial treatment, as I was telling you, and you should meet the doctor, and my doctor usually starts with an investigation like an X-ray. If you are able to put the weight on it, generally doctor can order you a standing X-ray, which gives us a more idea about ligament injuries. And if he has no clue on X-ray and it's only a purely ligamentous injury, sometimes he may order you an MRI, which is a very important test which can diagnose it better. So MRI is a better investigation to diagnose the ligament injuries. So depending upon the grade of injury, depending upon the high altitude or magnitude of injury, the treatment can be differed. Treatment usually starts with immobilization. So the moment you see a sprain, the most common treatment that is given is an immobilizing. So they'll give a splint which makes you immobile, so which makes you not to weight bear on for it few weeks until you feel better. So once the swelling and everything comes down, then the ligament injuries will be re-examined. Then we will get to know better what is going on. Then they will see if the ligaments or injuries are so severe. Sometimes we have something called as keyhole surgeries, arthroscopic surgeries. So all these ligament injuries can now be treated with a minimally invasive small incision surgeries with a very good implants, and all ligaments will be healed better, and you can return back to sports. So it's a key point is you need to get treated initially, you need to get checked up, and don't neglect the ankle sprains or thinking that it's a simple sprain. It can lead to a very big problem. Sometimes you'll get bony fractures. Sometimes most people, there is something called stress fractures. Most of these athletes, they run and they walk and they don't take adequate rest, and their proper footwear will not be there. That leads to something called stress fractures. The bones any bone in the foot and ankle can get fractured because of the over stress, and those things needs complete rest. Sometimes they need 6 weeks of cast. They'll be putting a non-weight bearing, and they'll not put weight on it, and they need 1.5 months of rest, and gradually start putting weight on it, and very gradual return to the sports is expected.